Let's talk about NCQA. You've been at the helm. You founded it 27 years ago.
Right.
And we're still turning out new initiatives, new programs, new measures, streamlined processes. We're busy. We're still staying busy. There's always more work to do. What's close to your heart?
A couple of reflections. One is, I think we're all in a hurry to be where we want to be in terms of having really more comprehensive information about quality, and we're not there. So we need to keep pushing on areas like cancer, where we're working with the American Society for Clinical Oncology and Community Oncology and Dr. Barbara McEnany to come up with a program that we all agree on that's going to make cancer care more reliable and higher quality. So that's very close to my heart because I have family members who have had cancer, and there have been obvious quality problems in every case that have been obvious to me. I think that there's also a piece about we're not where we need to be in terms of data and in terms of the ease of having quality information. So somehow we've managed to make life pretty miserable for a lot of doctors, and some of that relates to electronic health records that don't do what they're supposed to do. Some of it relates to quality reporting, and so there are things that have happened, I'm talking about unintended consequences again, that we need to pay attention to, and we need to solve the problem. We cannot have burned out people delivering high quality health care. They cannot do it. Humans can't be burned out and high performing at the same time. They can do it for a little while, but they can't do it on a predictable basis. So we have to make quality reporting something that feels supportive to the practitioners and not like a burden.
That they clearly see the benefits of it in serving their patients.
They want to do a good job, you know, so if they get the information at the right time when you're coming in and they say, Matt needs this, then they can excel in quality because the system supported them to do what they want to do.
And so I know that our IT folks are working on common languages and for electronic systems to speak to each other, first of all, which would hopefully reduce the burden.
Right, exactly.
The reporting burden and the record-keeping burden.
Right. And we want it to be part of the flow of the delivery of care. Right. We don't want people staying till 9 o'clock at night to fill out medical records. That is really a bad use of people's time. So we don't have the solution. We're not in the position to solve it, but we and others need to keep working this because this is a real emergency. It really is. And the third thing that is really close to my heart is vulnerable populations. How do we do a better job with frail elderly people, for example, or with people with disabilities, where, you know, the health care is part of their needs, but it's not all of their needs. And we don't want it just to be about health care. We want it to be about the person. And is the person better? Is the person less depressed? Is the person able to achieve life goals, like going to church or going to a relative's wedding? That part is very, very challenging, and it's incredibly important. So I feel very passionate about that.
Looking at healthcare as a whole, and I think you've sort of answered this already, but what is the dark cloud on the horizon?
I would say that at the basis, the dark cloud is the costs. Because there are two ways to go after costs, I mean, at a global level. One is to put people on a budget in some way with payment reform and so forth. The other way is to say, oh, why don't we just drop these people? Or why don't we just make people have to pay more out of pocket? The high deductibles that I was talking about before. You know, the easy way is to put it to the beneficiaries, to the citizens. The hard way is to get people to practice care delivery in a way that makes sense.
On all levels.
On all levels. Other countries manage to have better health outcomes with less spending. And if you look at the payment methodologies, they're always about budgets, they're about limits. You know, that's the secret. It's not, I mean, nobody has like invented the perfect healthcare system, but we're slipping down in the kind of national rankings. Unless there are people that are determined at every level of the system to do the right thing by our citizens, by our taxpayers, by our employers who are finding it's an international competitiveness problem. You've got to be committed to doing the right thing, and that's always hard. It's not the easy thing. It's the right thing.
But you've been harping at people for 27 years to do the right thing. Do you feel, and that's good, that's not meant as a criticism, but do you feel that that the supporters of doing the right thing, that group or that size of the group, percentage of the overall, has it grown?
Where we are today, I think we're in some danger. I think we're in some danger where we think that we don't see that the complex path is actually achievable. And so it's kind of like, well, it's the easy path, which is cut beneficiaries or cut enrollees or cut coverage.
The keep it simple.
That's the easy, yeah.
Uh-huh.
And keep it simple stupid is really not.
It might be stupid in this case.
Exactly, exactly.
What encourages you out there? What is going on that you think?
I
this
think
is a bright
about,
spot?
some of the great systems that are out there showing the way. They're inspiring, they're inventive, they're smart. There's a whole cadre of new quality people. I always say that when I started in this field, the quality people were in the double wide outside of the hospital. And they were very passionate about their work, but they weren't getting the resources and they couldn't do the job, and they didn't have the authority to really say, this isn't right.
The C-suite respect, so to speak,
exactly.
Right?
They were really kind of buried in the sort of infrastructure that people didn't pay attention to. So in the best institutions, the boards are very much learning about the quality of the organization. They're able to challenge the C-suite and say, why aren't we better, and so forth. So, I think the Medicare STARS program, as much as it's not perfect, nothing ever is perfect, it has put quality on the map for Medicare Advantage plans. And now we need to be able to say, how much value do we get for Medicare Advantage compared to classic Medicare, compared to ACOs? We need to be able to look across both, as consumers when we're making our choices about who's going to cover us and where we're going to go for care, but also for policymakers, because it's a pretty confusing landscape out there.
And we need to gather that evidence to prove that
right.
Quality does assist in the overall value.
Well, to show
right?
where do we get more value? What are we paying and what are we getting in these different segments?
If people thought that way about healthcare, it'd be a different world. Wouldn't it? If consumers thought, what am I getting for my money?
And by the way, this is a nonpartisan issue.
Right.
This actually, comes out of the work of the market. Economists were at the table when NCQA was dreaming up our agenda.
What is Peggy O'Kane's most dangerous idea?
I think that one of the things that I see today, we're looking at a lot of digital health applications and so forth. And it seems to me we have the capability to really take the consumer, arm them with those tools, and have them take more of an active role in their own health. It is dangerous because we can't just throw it at them and assume that everybody's going to feel good about it and do it. It has to be managed, it has to be used where appropriate, and watching what's happening, because there could be a lot of unintended consequences. So that's a really dangerous idea, but there's tremendous upside for that, both in terms of the person feeling more agency about their own health, and in terms of saving money on, not having your doctor have to sit there and lecture you about getting a mammogram.
Peggy O'Kane, thank you very much for, it's always good to hear you expand on the issues of the day.
Thank you, thank you.